worries. Thank you. And thank you to Courtney for the continuing hard work that you do to make sure these presentations are brought to the city of Brantford and its residences. So thank you so much for inviting me today to speak to everybody about ageism, which is becoming more and more of a topic of concern for a lot of older adults and those of us working with older adults, to ensure we understand how ageism can affect, sometimes, as we say, these prejudiced social norms that have become acceptable to our older adults around the world. So my name is Mary Shkoury, and thank you again for introducing me from Elder Abuse Prevention Ontario. And we're going to be going through the next 45 minutes having a closer look on what is ageism and how it is affecting older adults here in Ontario, in Canada, and truly around the world. So a little bit about Elder Abuse Prevention Ontario, for those of you who may be joining for the first time and becoming familiar with our organization. We first and foremost would like to thank the Government of Ontario, who continues to fund us through the Ministry for Seniors and Accessibility in understanding the important work that needs to continue to stop abuse and restore respect here in Ontario. As we always say, simply put, we all have a role to play to combat elder abuse. Our mission, and really for, if I can say, the entire team at Elder Abuse Ontario, our passion professionally and personally is to see our Ontario, where all our seniors are free from abuse, have a strong voice, and feel safe and respected every day. We work by bringing public education and awareness to provide information, services, and training and education to the public on a variety of topics surrounding elder abuse. We train frontline staff from our policing partners, hospital partners, emergency services, fire services, really any frontline staff working directly with seniors, because not only do we want to enhance their knowledge and skills to recognize elder abuse, we want to help them to be able to respond as well. And our continued work with community services across the province, really across the country, because we know by strengthening our partnerships, promoting information, and sharing and supporting our efforts together, we can combat elder abuse in Ontario and across Canada. So today's framework discussion is going to take us through understanding what is ageism. Ageism has become a social norm, and what are some of the consequences that has led to this? We're going to look at some everyday ageism practices that we follow and some guiding principles to help us understand how to combat these negative stereotypes. And we will leave time at the end for Q&A and, of course, some open discussion. I'd like to begin by the definition, first and foremost, of what is elder abuse. And this comes to us from the World Health Organization. So in understanding that this is a global epidemic affecting seniors around the world, elder abuse is a single or a repeated act or a lack of an appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. And this definition is used around the world to help us understand what elder abuse means and the effects that causes that harm or distress to an older adult. And every year on June 15th, we mark World Elder Abuse Awareness Day. And on October 1st, with the United Nations around the world, we mark the day of the International Day of the Older Person. And the last few years, both focuses on these very important days, June 15th, October 1st, has been on ageism and its correlations and effects to contributing to elder abuse around the world. Because as we know, abuse is a misuse of power. So it's an imbalance of power between the abuser and the older adult. And this is what happens when power is taken over from the abuser and the older adult loses control in the relationship. Many times people will ask and say, is elder abuse a new issue? Is this something that has recently happened? Are we just hearing about this because of the effects of what happened during the COVID pandemic? No. Elder abuse has been happening, sadly, for an extremely long time, where we have seen older adults suffering well before the pandemic. They have been dealing with emotional heartache, physical pain, and even financial losses. What we have seen during the pandemic was it brought more to light on the abuses that were happening across the country to older adults. And we know this can impact seniors residing in all parts of their communities, from the homes they live in, the senior residents they reside in, to long-term care homes, to retirement homes. So elder abuse can impact seniors in all of their home settings. Some of the forms that we discuss further about elder abuse focus in from financial, emotional, physical, sexual, and neglect. And sadly, with elder abuse, we know multiple forms of abuse can occur at once. Just to give everyone a little bit of prevalence of what we see happening currently around the world is from reported elder abuse cases. In 1 in 6 older adults have reported one form of elder abuse or another that has happened to them. In Canada, from our last study that was conducted from reported elder abuse cases, we had a prevalence of 8.2% of seniors that we spoke to. So this gives us a percentage of about 1 in 10. And of course, we do know these numbers are much higher because many seniors are fearful to come forward to report elder abuse situations that they are in. And today, in understanding how ageism plays a very crucial role in elder abuse, we want to speak today about what is ageism, understanding why it happens, and how it affects those negative stereotypes that can lead to potential abuse for our older adults. So what is ageism? Well, exactly that. It's that stereotype on how we think. It's a prejudice on how we feel. It's a discrimination on how we act towards others because we are basing this on somebody's age. And those are the only factors we're using to refer to what is ageism. We're using those prejudices, those discriminations, simply based on one's age. It is sad to say becoming a social norm, where we believe that it is almost this social accepted prejudice that we can have these ageist attitudes and thoughts towards our older adults. To the extent that many older adults say they don't feel as if they fit into the norms of society. They feel they can be treated less than and have been told that they are almost invisible. And these are becoming these norms where many seniors have said to us, they feel as if they're second-class citizens in their way they're living their lives and how they're being treated. During COVID, and sadly, even more so now, we continue to see these stereotypes of messaging as if COVID was wanting to be blaming our older adults, that this was a virus that was only affecting the elderly, that we should not have lockdowns, and that nothing should happen to the young because they are strong, and it's only killing our older adults. There was such harmful messaging happening on social media, our local news stations, that many older adults were in fear because they felt they were being blamed and targeted during this horrific time as the pandemic is still happening, around the world to us. And it's almost was saying to us, why are we allowing this? Why are we accepting this? And why are we saying it's okay that it's affecting our older adults? These are some of ageist attitudes coming through in the most shocking, horrific, and hurtful forms. We saw messaging around the world that was so hurtful that it showed us that the world does believe it's okay to blame seniors. This is just one of the examples that I wanted to show everyone today, where people had signage saying, sacrifice the weak, reopen, I need to go to my restaurant, I need to go to my hairdresser. And these are the ageist messages we want to eliminate. We want to educate people on and help them understand that this is hurtful and that these negative stereotypes have an effect to cause so much pain to our older adults and those working with seniors around the world. What do we know about our ageist attitudes here in Canada? With studies that we've conducted through the International Federation on Aging with the Rivera report, we have learned that 6 in 10, so 63% of our seniors across the country have showed us and told us they have been treated unfairly or differently simply based because of their age. 8 in 10 of our seniors, 79%, agree that seniors are seen as less important. And 1 in 5 of our seniors that were surveyed, 21%, said they do see that older Canadians are felt as a burden on healthcare systems, social service systems across Canada. These numbers, sadly, are shocking and frightening, that we have allowed this to become this social prejudice that's so tolerated and accepted, that is contributing to our attitudes on older adults. This prejudice, as we say, becoming so tolerated, has showed us that most people believe it's acceptable, that it's not a hurtful form to have these thoughts, that it's just become this acceptable way in society to think. And in some of the studies, when we have worked with our younger generation, they feel that this, social norm does not have any hurtful repercussions, or that they don't really understand, by using ageist statements and attitudes, what are the effects that are caused to older adults. And we know that ageism and elder abuse are linked in so many different facets, when understanding that having these attitudes and prejudices, this can lead to even well-meaning family members and friends who can sometimes push an older adult to do something that they don't want to do. From a well-meaning family member perhaps saying, I think it's time to sell your home. And if they receive any kind of pushback, this could perhaps begin to further lead to more heated conversations, more negative emotional abuse towards the older adult, and using those ageist attitudes as what you're too old to live here. You're too old to manage the home. You're too old with the upkeep. And again, these are those ageist stereotypes that then could lead to a potential abusive situation if the friend or family member may feel they are not getting their way and that they know better because they are of a younger generation. And this is where we have seen that correlation time and time again happen between ageism and leading to forms of elder abuse happening to an older adult. So we ask, is ageism really a problem? Sad to say, half the world's population is ageist against older adults. On our last study on October 1st of 2022 with the United Nations, we received samplings around the world from older adults who came forward to speak to us about how they're perceived in their communities. And this was from continents all over the world. Younger adults were spoken to and felt that their mistreatment or this stereotype, again, as we said, was acceptable because if they see someone else doing it, well, then they feel that this is all right to do. Our mission and our goal is to continue to stamp out these ageist attitudes, to bring education and awareness when we hear or see ageism happening, to let people know this is hurtful and this is not an acceptable form of a prejudice. Because as we know, we're all getting older. Our world is aging. We are aging. With our last Census Canada statistics, we see once again, Canada is older than we are younger. Our population of seniors is greater than our population of children 0 to 14. We see shifts in the workforce as we are aging and we are beginning to retire, and there is not that new generation coming in to fill those positions. That's why our immigration is increasing, so we can bring more people into the country because we are aging. And this is happening around the world. And by 2050, which is not that far off, our older population will reach over 2 billion older adults over the age of 60. And so this is showing us that we want to immediately put in place changing the mindset of ageism, because as we all age, we want to live in a world where our older adults are treated with kindness, respect, dignity every day. And these are just some of the growth numbers of our wonderful country, with our expected growth in the next 20 years that our senior population will grow by 68%. And seniors living 75 and over will actually double in size across Canada, coast to coast around our country. So to confront ageism, we have to work together to confront these ideas and attitudes, these beliefs and practices that people have on these biases against our older adults. We want to, as I say, eliminate what has become this social norm. We want to ensure by continuing our work to confront ageism, it will lead us to help confronting elder abuse. Because when that correlation happens and that leads to the emotional neglect, sadly, the physical, sexual, and financial abuse of older adults, we will only be able to have these conversations when we understand where are these ageist attitudes coming from that make us believe older adults don't matter. Because when we think about aging, what does come to our mind? How do we see ourselves? How do we see older adults in our lives right now? How do we see members in our community? And so, really having those conversations within our own family circles, within our own community, and with our own professional circles to understand, what do we feel about aging? How do we personally see it? And how is it that we're working in our communities every day to ensure older adults are feeling safe and respected? There has been many studies on aging and the perception that people have with, especially the beauty industry. There has been many studies and campaigns where there was recently one, if I can share, out of the University of California, where they were offering two types of anti-aging creams. And one was, of course, going to give you this fountain of youth. This cream was going to promise all these miracles of eternal youth and beauty. The other cream was going to give infinite wisdom and experience and knowledge. And they had two booths set up to do this study to see, which sample of cream would you like? I'm sure you can take a guess, but everybody was lining up for the anti-aging cream to tap into that fountain of youth, and no one had stood in line for the anti-aging wisdom cream. Takes a moment to kind of say, that's where our thoughts are about this, norm that we feel we have to continue to look a certain way to conform to what society expects of not having wrinkles or not having gray hair, not having laugh lines, that social media and perhaps, saying even the television and movie industry want to continue to portray this youthful look constantly, and that we all need to try and strive for that. And that was just one of many campaigns that wanted to bring awareness to people about aging and anti-aging. And of course, as we do know, both creams were just used as a ploy to see where would people go, and neither could promise anything. But of course, our mindset is to go to looking that certain youthful way. Because these attitudes that we can have, we know can put older adults at risk for ageism and elder abuse situations that they may face. Some of the common speech and behavior that we use that have almost been ingrained in our vocabulary, from saying to a senior, wow, you still do that? Isn't that the old-fashioned way? Or, I'm having a senior moment, which has become that, quintessential, oh, I guess I'm forgetful. Saying to an older adult who may be applying for a position at work, saying, well, you just might be too mature for this position. Instead of saying, you're going to bring so much knowledge and wisdom and experience, our team knows you're an asset to come on board. You don't look your age. Well, what age is it that I am supposed to look? Hurtful statements that we may say where, older people are so forgetful, or they just don't understand how the world is changing. We saw during COVID, of course, where technology was playing a huge role for us to be able to communicate using Zoom technology, using our cell phones, FaceTime. And for many seniors, this was the first time they were diving deep into this type of technology. And they became so resilient and so profound in using the technology. Courses were set up to help seniors become familiar with technology and how to use it. And they rose to the challenge to say, yes, You're never too old to learn, and you're never too old to say, you know what, I want to learn something new. Age is simply just that number. And today, many of our seniors are enjoying using technology and continuing to do so. So we cannot say that, you're too old to learn and understand something. Everyone has the power and the resiliency to be able to do so. And so these are these statements that when we hear them in conversations, maybe with friends or family or our colleagues, we want to be able to say, those are ageist statements and they hurt. And seniors deserve to be treated better and not use this type of language and statements in how we interact every day. When working with seniors in my professional career and in my personal life, I want to always ensure we never speak to someone as if they are a child. We never want to teach our adult children, when we work through Elder Abuse Prevention Ontario, that they sometimes feel they have this entitlement to perhaps their parents' money and assets. They may say to us, my mom doesn't need that two-story home. She no longer needs the car in the driveway. She barely drives it. I should be enjoying it. I should have these things. We want to help educate and bring awareness to say that entitlement that you have perceived is causing not only ageist attitudes, but potential abusive situations, because these are not things that you are entitled to, that your parents have the right and the decision to decide what is best for them. Seniors have spoken to us many times about situations where they feel they're not included in family conversations, that people are always talking around them, but not to them. By, the family coming over and wanting to make decisions for mom or dad, and not once turning and looking over and saying, Mom, Dad, what is it you would like to do? And so by working together with families and with counseling and through mediation, we always want to say to people, include everybody in the conversation and always ask, what is it you would like to do? Because everyone has the right to voice their opinions and be part of that conversation. Using terms such as the aged or the elderly can be very hurtful, and in certain situations feeling very demeaning to a senior. By addressing a senior by using, endearment terms such as sweetie, just because they are older, may make them not feel as recognized, but still being able to address somebody by their surname, Mrs. Shkoury, Mrs. LaBelle, before using an endearing term if we are not at that, level of connection with that person, to use respectful ways in speaking to someone and how we address them. The stereotypes that we have heard and seen from people on speaking about older adults and their beliefs on seniors, that, well, they're slow and boring. Perhaps saying, they're mentally incompetent, or, they always have forgetfulness and they have cognitive impairments and they just don't get it. Or seniors think they know everything. Seniors don't have sexual feelings. They're a burden on our healthcare system. Well, don't they just all live in old age homes? Oh, they're always so cranky. Oh, they're wise because they know so much. They're all angels from above. And all seniors are bad drivers. So some of the stereotypes that ageist attitudes have been shared, and the beliefs that people think, that of course I can imagine some of you may be giggling as you're hearing or watching this now on the webinar, but knowing these are all these myths that we want to talk about, educate on, and help everyone understand that this is not the norm, but these are the stereotypes that have been created through ageism. Because as we know with ageism and the discrimination to our seniors, they are closely linked because of these negative attitudes and discriminatory behavior towards our older adults. Some of the consequences that we can see happening when we have this age prejudiced stereotype for our older adults can impact with seniors receiving poor medical conditions or health outcomes, where many seniors have spoken up and said, by visiting my healthcare practitioner, I'm told, well, you're old. What do you expect? Of course, you're going to have these ailments and illnesses. And many seniors have said to me, Mary, how is this a medical diagnosis? How can a healthcare professional say this to me? Seniors have faced employment discrimination because many employers do not want to hire older adults because they feel they will be more of a burden rather than seeing the assets that they will bring to an organization. With financial losses from financial abuse and frauds and scams that target our seniors, sadly, many have seen significant monetary losses that have happened in their lives when they're targeted by financial abuse. Increased social isolation and loneliness happen when seniors feel they don't belong in a group setting, or they're not welcome to be part of a social engagement from family members. And they become more and more socially isolated in not being involved anymore in activities. And this is where we want to continue to let our seniors know that social isolation is one of the key risk factors for elder abuse, and to be involved with their community, with their faith groups, with community programs for older adults that are available, and to know that having social awareness and social connections keeps people safe and part of their communities, and it is part of a healthy aging process. We have seen ageism and the consequences from the environmental stressors that have happened, and of course, compounding and leading to elder abuse. So what we want to do is work with different groups across the spectrum, from hiring human resources in the workforces to recognize this stereotype on older adults and to avoid making these ageist assumptions. Work within your human resource organization through corporations and companies to offer training and information on ageism and eliminating these stereotypes. Always watch for these cues, these social cues in your workplace. If hearing or seeing ageism stereotypes, attitudes, or beliefs, to eliminate them and have an open dialogue with employees. Together, by working and implementing mentorship programs, we can bridge the gap between our new hires and our older generation, to working together to build strong bonds and a healthy workplace that thrives with everybody working together and mutually respecting one another. Because as we say, this puzzle of ageism is one that we need to be putting together. Because if getting older is something we do every day, then there should be no exceptions for us having these ageist attitudes. Why are we discriminating when all of us are going to become older adults one day? So that is sometimes the opening dialogue in saying, let's put these puzzle pieces together and understand that this place of ageism has no place in our workplaces, in our homes, in our communities. Let's end these stereotypes and work together on understanding the hurtful outcomes of what leads to and contributes to ageism. We can overcome these ageist attitudes by supporting our older adults in our community, taking these stereotypes and understanding what those consequences are towards our older adults. When we understand ageism, we understand the causes and effects and its negativity in our society. Valuing our older adults, knowing the value, the joy, the wisdom, and the knowledge they bring to us as part of our community members, as members in our family, and in our workplaces, that we are all valued together. And knowing and valuing the contributions of older adults and recognizing them and celebrating them will contribute to us furthering understand that ageism has no place in our lives. For our older adults to ensure they feel safe and respected in their communities and to prevent elder abuse, ageism from occurring in their lives, we want them to always stay active and connected. Maintain good regular contact with one or two or as many close friends as you have in your circle, and have that support from family. By being active in your community, you become part of feeling part of that and sharing and enjoying in the activities that are available. Always ensure you have access to your own telephone, be it your home phone or your cell phone, and know that you have access to opening your own mail, that nobody is controlling that from you. Always, at any age, we should always be familiarizing ourselves with services for seniors, so if and when we need to contact them, we know what is available. Taking care of our own healthcare decisions and speaking to our family and friends about what are our wishes, what are our desires for as we age, what are things we want to put in place, and perhaps having that conversation about when it is time to have a power of attorney signed and whom it is we'll trust to look after our finances and our healthcare decisions. And if something feels wrong and you feel you're maybe being abused, or you're concerned about someone in your life, a friend or family member, to have those conversations and be there to support and guide an older adult who may be experiencing elder abuse. In Ontario, we are very proud of our senior safety line, which is a 24-hour, 7-day-a-week line to reach out to an elder abuse consultant through the senior safety line for information, referrals, and to have someone there to listen. We are available 24 hours a day, 7 days a week at 1-866-299-1011. And we also offer over 200 language services available through Language Line should the senior need to reach out and communicate in another language that is more comfortable for them. So again, 1-866-299-1011, the senior safety line, available day or night, 7 days a week. Also, 211 Ontario is the Ontario directory to help anybody connect to government and community health-based social services across Ontario. 211 is a free phone call away, and the operators there have access to services, community services, senior organizations in your communities. It's an easy phone call away, and the 211 operators are always there to be helpful and let you know what services are available in your community from government and community-based health and social services. So a nice, easy number to always remember, and 211 can help access all those services for you. As well as the Elder Abuse Prevention Ontario website, we hope that our website continues to bring valuable information from our training tools, resources, tip sheets. We offer customized training and education to organizations and groups right across the province. Our social media channels as well, where we continue to bring updates about information and current events. And if I could just let everyone know, January 31st, my goodness, as we round out the month, first month of 2023, our virtual conference will be held once again this year. Registration is now open through the Elder Abuse Prevention Ontario website. It is free of charge. It is a one-day conference on the 31st, where we're bringing Canadian and international speakers to discuss elder abuse here in Ontario, Canada, and around the world. So please feel free to visit us on our website and register for this one-day fantastic virtual conference that will bring very important needed information, resources, tools and guides, as well as information on elder abuse. Again, just to let everyone know, many of you may be aware of, last year, we launched our roadmap to elder abuse prevention in partnership with the Canadian National Prevention Against Elder Abuse, and many of our partners from every province, to bring a pan-Canadian engagement strategy to our federal government. The Future Us guide is available for download in English and French, and it helps and works with you and your communities on how to combat elder abuse and messaging that we can bring to our federal and municipal governments as we continue to advocate for our seniors across the country. And I just want to share a very quick video that was put in production through this program, funded by the Justice Department of Canada, on ageism and how we all want to be treated. So I'm just going to make sure we get that to play, and here we go. Oh, my apologies.
How you treat older adults today makes a difference to your future. Someday, it will be you. Your words and your actions have an impact every time. Every time. Be wise in your choices. Be thoughtful in your actions. Treat people today how in the future you will want to be treated. Imagine yourself as much older than you are now. Will you want to be treated like this? Think about it. Chances are the future you will want to be respected for your life experience, to have people who love you, to feel like you belong and have purpose, to feel like your life matters. And you are probably not alone. Yet in Canada, 63% of seniors say they have been treated unfairly or differently because of their age. Discrimination based on age is a violation of human rights. It's called ageism, and it's a big problem. We all deserve to be treated with dignity and respect, no matter what your age. Learn more about seniors' rights. Visit Elder Abuse Prevention Ontario. EAPO is partnering with provincial and national organizations to help address ageism and prevent abuse, because working together across the country is the way forward.
Thank you. And again, to acknowledge and thank the Department of Justice Canada for their support in helping to fund the work that we continue to do, and our partners with the Western University, the Centre for Research and Education on Violence Against Women and Children, and our partners with the Canadian Network for the Prevention of Elder Abuse, and all our provincial partners across Canada. For more information on ageism, there is one of our amazing speakers by the name of Ashton Applewhite. She is an American-based speaker, around the world renowned for her work and continuing championship on ageism. You can feel free to look her up. She's got great videos on YouTube on many of the talks she has done. We were honored to have her last year at our Elder Abuse Prevention Conference in speaking about ageism, and you can view that through our website as well. And she continues to champion work around the world in bringing light that aging is not a problem to be fixed or a disease to be cured. It's a natural, powerful, lifelong process that unites us all. Because as we know, and we say every day, oh, it doesn't matter your age, every person deserves to be treated with dignity, respect, and kindness every day. So thank you so much. My information is here. If anybody would like to contact me directly, my cell phone number, my email, as well as our website at eapon.ca, to feel free to reach out if there's anything you'd like to speak about confidentially at any time. Know that you can reach out to me. So thank you so much. And I'm excited to open up for some Q&A and discussion with everyone.
Awesome. Thank you so much, Mary. That was a really informative presentation, and you gave a lot of great examples and resources as well, which was really great. I am just going to go ahead and stop the recording now, and then if we want to open up the floor for any questions, comments, discussion, we can do so then.